with Dr. Benita Zahn.
When the world paused for the pandemic, so many of us put off health care. Now, as things have eased, healthcare providers are reminding us to attend to our well-being. In short, your life may depend on it. Dr. John Bennett, President and CEO of CDPHP, joins us to discuss this.
Hi, John. Thanks for taking the time to talk with us about this.
Hi, Benita. Thanks for having me. I'm pleased to be here.
You know, during the height of the shutdown, there was a lot of concern that people who were experiencing heart issues were not calling and going to the hospital. But you're talking about something really much larger. People aren't going for cancer screenings. They're not going for vaccinations. They're not going for treatment. Give us a sense of how big a problem this is.
So, Benita, we're seeing a problem with people not going for preventive care, particularly around cancer screening, around long-term prevention with regard to everything from cholesterol to diabetes care. And there are long-term implications of that, right? So we're seeing cancer screening rates drop. So we track very carefully. We're very proud of our quality measures and metrics that show that our members get screened for cancer, that they get their hemoglobin A1C tests if they're diabetic, that they get their diabetic eye exams. And what we're seeing is a degradation in that performance. And CDPHP is not alone in that. As we talk to payers, not only in this region, but throughout the country, in areas that have been affected by COVID, we're seeing that. And we're very concerned about it.
As you look down the road, are we talking life and death?
I think down the road, potentially we could be talking life and death. I mean, if you don't get a screening colonoscopy and you have an underlying malignancy that then presents at a later date, it could possibly be related to a death. If we're talking about getting diabetes control, we know that controlling diabetes leads to fewer heart attacks, right? So so we're talking about potential death and disability, blindness, for instance, with eye exams, kidney failure with diabetics. So we're talking about serious stuff. Prevention works.
How do you convince people to go to the doctor now? I mean, there are some folks who are still reluctant to even go to the market.
So to convince people to go to the doctor, we've done several things. One is we have made it very easy to get televisits, and televisits are helpful as long as they then lead to, because some things you obviously can't do a colonoscopy through a video visit, and you can't draw blood that way. But at least if you do the visit, then your doctor is going to set you up to have that visit. So we've made it very easy for people to get video visits and televisits. There's no co-pays, there's nothing. And we're paying the doctors at the same level as we pay them if they see the people in the office.
Let me jump in. How long can an insurer continue along these lines where you don't charge a copay, but continue to pay out at the same rate you did before? So
how long an insurer can do that? We certainly can continue to do it for a while longer. And I will tell you, we just had a meeting this morning that certain features of that we may continue indefinitely. We're finding that we may have a much different policy for copays and coinsurance for televisits that transcends and goes long after COVID is over. Not totally baked yet, still working on it, but there will be features of this that will last indefinitely.
As we're headed back to school, you know, a lot of the college kids have already gone, elementary, you know, secondary, it's still being questioned. But this is a time of year when a lot of kids would have gone for a physical, would be getting immunizations. Let's talk to those parents who are reluctant still to bring their children in.
Right. So I look, and I tell my own children who have children. So I'm a grandfather, and my grandchildren are returning to school. I believe school is safe. I believe that, and they will get their immunizations. Immunizations are vital. There are real threats out there in terms of disease, and for children, quite honestly, COVID is not as big a threat as influenza, for instance. We have to remember that. More children still died, I believe, this year in New York State from influenza than died from COVID. I believe that's a fact. So immunizations are very, very important. None of that goes away. And so I think we have to make people understand that hospitals are safe, that physicians' offices are safe, and that schools can be safe.
And if somebody has a concern about that safety, are there certain questions that they should ask of their provider before they make the appointment and walk through the door to allay their concerns?
Sure. I think if people are concerned, you should ask your provider what precautions they've taken, whether or not they will have appropriate protective equipment, masks available, what have you. And I think you'll see, and I've been to the doctor during COVID. I actually went at the height of COVID. I had a physical visit with my doctor, appropriately masked and separate from people. And I think you just have to ask about what those things are. And I think you'll see when you go to the doctor that providers are doing that. They're very careful. They screen you for symptoms. When you walk in the office, they screen anybody that's coming with you. If you're a parent, you got to go in with your child. They have to screen the parent for symptoms. They have to take your temperature. So I think, all these things have to be done, and they can be done, and they are being done. And we know from our close relationship with our physician providers and our hospital providers that all those things are being done. And we meet continually with our providers, our doctors, our hospitals, and we know they're being done because we're there. I mean, I and our staff at CDPHP, we go to the providers' offices. We're still going. We go to the hospitals. Our hospital experience folks are in Albany Medical Center, St. Peter's, Ellis, Saratoga. They're all over, and we know it's safe. And I think when you go there, you'll see that.
And hopefully folks have listened. They take to heart your message and take care of yourself so that you can get through this crazy time.
We will get through this. We will persevere. We will get through this by doing the tried and true things that we've always done in this country to get through crises. And we're already getting through it. There is great hope.
Dr. John Bennett, President and CEO of CDPHP, thanks so very much. Stay well.
Thank you. You too.
And thanks for joining us. We'll see you next time right here at WNYT.com for Health Beat.